A very good evening to everybody. And there are many practitioners who are there, many teachers who are there. A very warm welcome to all of you from the Divine School of Homoeopathy. And we are meeting after gap of 3-4 days. In fact, we have started discussing with the LMZIPA followed by Euphrasia, a comparative remedy. After that, we have started with the Arnica. After Arnica, immediately we followed with the Calendula. So injury remedies we have started discussing about from the second year syllabus. And one more injury remedy today we have to discuss is the Hypericum. It is a very important remedy. Hypericum Perforatum is a very important remedy in day-to-day practice. In fact, those who are having their hospitals indoors or where hospital setup is there, this remedy plays a wonderful role. Basically, this remedy I have used many times. First case I want to share with all of you is the case of coccygodynia. That is, there was severe pain in the coccyx because of injury. The patient fall on the directly on the road and directly on the seat, and that jerk started produced a severe pain at the coccyx. The patient came along with the tire tube, the scooter's tire tube, and when patient was sitting over there on my chair, she said it's very difficult for me to sit, and she really put that tire tube over there. Then they tried to put seat over there. After 5 minutes, she was comfortable while dealing with the case, and this pain is very severe when she was turning in the bed. It was a very severe nerve injury. Already she had consumed lot of painkillers. Even someone have tried to put a corticosteroid over there at the coccyx region, but never worked. Because this is the site where the oral material medicine never reaches so easily. And that's why pain, if patient gets pain relief, it is only for few hours. It never disappears. And it's a big injury because it is nerve injury. So first remedy, whenever there is a coccyx pain, I used to always think about the Hypericum. And whenever I used to give the Hypericum works beautifully. Hypericum works so nicely in such types of cases. There are few remedies for the coccyx injury. One remedy is lachesis. Never forget, lachesis is very important remedy for coccygodynia. Second is calibicromicum because the pain is very at the specific site at the tip of your finger. And it is also mentioned for the coccygodynia. If you open your repertories, you can get that. And this is wonderful remedy, Hypericum, which plays very vital role to tackle the coccygodynia. So I have given her Hypericum 200 in repeated doses and asked her to reply me on day after tomorrow. And the day after tomorrow, I got the patient's reply, yes, sir, it has really would make a wonder. I forgot yesterday to carry the tire tube, and still I was able to sit yesterday evening. There was some function. I went over there. It was looking odd to take away that tire tube along with me, and it was wonderful that I was able to sit over there without that. It works so fast. It is a very sensitive remedy which has capacity to work very fast. Acute action is there. So that was the first incidence where I have used very successfully Hypericum. It was way back. Second case, which was there in the Bhagli hospital, I have treated because sir was not there, and in the afternoon there was a patient brought to me with as good as the complete finger is totally detached. Just one point where it was attached. Otherwise, it was really a complete two pieces of the little finger. So what I have done very good stitches. I was very good with the work, with that fine work over there, because it was off and on work over there. So I took the stitches before sir come, and then I asked them to bring this Hypericum from the Cure Homeo Pharmacy. So they brought, and I have given Arnica, Hypericum, and I have put the calendula mother tincture over there. When sir saw that, he said, Prasad, it is quite difficult to survive that part of finger because it was just on the few points which are remaining. But let us try what happens. Let us see what happens. And we asked the patient to come after 2 days for dressing. And when he came for dressing, the part survived. The little finger survived. It is one of the important remedy along with the calendula to fill up that parts, and it works. So this is wonderful remedy. One should not forget. For crust injuries, we have used it many times. Are you getting my voice or not getting it properly? What do you feel? Is it clear?
Yes, sir, we can hear
Yes, sir.
you.
Yes. Okay.
It is clear, sir.
Okay. Okay. No problem.
Yes, sir. Clear, clear.
Okay. So I have used that for the crushed injuries, and I used to get many crushed injuries because Bagli Hospital was situated near the many factories were there, and many such patients used to come, and I have used this remedy wonderfully with there because it has a capacity to calm the nerves. The sensitivity of the nerves tackled very easily whenever it is because of trauma and neuritis is there, very sensitive, very painful. Whenever the injuries are near the nail bed, it is always a very sensitive part. The pains are dangerous. Even patient can go into the depression because of that. And one should not forget this remedy. Depression caused because of nerve injury, hypericum is one of the important. So I have used in many such types of cases where nail bed infection is there because of injury, whenever there are crushed injuries to the fingers are there, and it is a wonderful remedy whenever any trauma happens to the spinal cord. So if you have case of spinal cord injury, never forget about the hypericum. Give the hypericum stat immediately. It is a very important remedy which settles or maintains the spinal cord properly. So it is one of the important remedy for spinal cord injuries. Never forget. So these are very essential things, and this has been indicated in books that it prevents the tetanus. There are two remedies which are indicated for that, ledum and hypericum as a preventive. Many times I used to give hypericum whenever crushed injuries are there, open injuries are there, along with calendula locally. I used to use the hypericum over there, and that maybe that prevents the specifically tetanus. We don't know exactly because it has been mentioned specifically that for the prevention of tetanus, either a ledampal, either a hypericum, these are remedy. In ledampal, the injuries are more pinpoint. Hypericum is also having pinpoint injuries, but rather there is a very little difference. Whenever hypericum is there, the pains are so severe and lancinating, stinging, painful. It is too much severity because they are very sensitive. Comparatively, whenever the ledum injury is there, even though it is pinpoint, specifically it produces a little bit pain which is of a sore type over there with inflammation surrounding it. That happens in ledum. So there is a difference whenever spinal cord injury because of spinal anesthesia, or whenever the patient tries to do a CSF for the CSF collection, when they do a spinal cord injury, that itself can be cured with the help of hypericum. So this is one of the important remedy in our daily practice. One should not forget. Now we'll learn what the Allen wants to say. So let us go with Allen's keynotes because it's small remedy, and everywhere these are the things which are mentioned many everywhere it has been mentioned only for injuries, but not for the psychological complaints or for the mentals. We'll go with Allen's what he says. Hypericum perforatum, St. John's wort, Hypericaceae. Mechanical injuries of the spinal cord. See, very important. First sentence only defines mechanical injuries of the spinal cord. Bad effects of spinal concussion. Spinal concussion. Concussion is a very severe jerk. It is a spinal concussion. Whenever the jerk is to the head, the first remedy to be think of is natrum sulphuricum and arnica. Whenever it is to the spinal cord, think about the hypericum. Pains after a fall on coccyx. This is too important. Just underline that. And you can get such cases in your practice, coccycodynia, again and again. Because it never gets very easily cured with allopathic painkillers. Punctured, incised, or lacerated wounds. All types of wounds are there. More punctured types or incised type or a lacerated wounds. Sore, painful. One more remedy close to is ledum. In ledum, you get more soreness, more inflammation along with punctured wounds. Contused wounds. So whenever there is not open wound, it is contused, just a trauma, contusion. Arnica plays very vital role along with hemamelis. Second remedy which is mentioned for that is hemamelis. Punctured, incised or lacerated wound, especially if the of a long duration. So even though it has happened that 2 months back patient had an injury, such type of injury, and still he is suffering from it, the hypericum plays very vital role. It is as good as similar to the arnica. Here in arnica also we have learned that sentence. The injury of years together, still patient has a problem, then whenever there is such a history, think of arnica. But those were blunt injuries, here they are the crushed injuries, lacerated injuries, or punctured injuries. How are the injuries? Then he mentions injuries from treading on nails. So near nail beds, around the nails, needles, pins, splinters like ledum. Ledum is close to it. Needle, whenever needle is there, nail is there, and punctured wounds are there, the ledum plays a very vital role. Injuries from rat bites, very important. Rat bites, dog bites, but this remedy is very important remedy to be utilized immediately for the purpose of that injury. This remedy is there. Ledum and hypericum, these are two remedies. Injuries, it prevents the lockjaw. So because of in severe injury, if a patient goes into the lockjaw, sometimes because of pain, because of fear, many times it is because of pain only. Severe pain can lead the patient into the convulsion. This remedy is a wonderful remedy. Preserves integrity of torn and lacerated members when almost entirely separated from the body. And this was the sentence which led me to prescribe hypericum in that case, which I have shared. So this is the sentence. It is as good as detached. The organ is detached, the part is detached, so much small part is remaining, and it is a wonderful remedy to maintain the life over there. So hypericum plays very vital role along with the calendula locally over there. Calendula bridges the gaps. So wherever there is a gap, the granulation tissue which develops over there and heals with first intention, calendula plays very vital role. Injury to the parts rich in sentient nerves, very sensitive nerves, wherever the sensitivity. So which are the parts? The fingers, the toes, the matrices of the nails, the palms or the soles. These are the very sensitive parts where there is rich blood supply and rich nerve supply. These are the parts where injuries are there. Think of hypericum. Where the intolerable pain shows nerves are severely involved. See what is it? Where there is pain is so severe that nerves are severely involved of tissue, injury of the tissues of animal life as hands and feet. So this is very important remedy whenever there are injuries to the hands, feet, parts very sensitive, rich of blood supply, rich of nerve supply. This is the remedy which does a wonderful work. Nervous depression following wounds or surgical operations. This is one of the important feature. Nervous depression. It is nervous means not Marathi nervous. Nervous means because of nerve injury, because of nerve pain, because of neuritis, and because of which the depression is developed following the wounds or surgical operations. So whenever the big surgical operations have been done and patient goes into depression because of pain, the hypericum plays very vital role. Removes the bad effects of shock. Very important. Patient may enter into the shock because of pain, not because of loss of vital fluids. Here it is because of pain when patient enters into the shock. The hypericum is the remedy. Removes bad effects of shock, bad effects of fright, or bad effects of mesmerism. So this is wonderful remedy when such a thing happens, when because of fright patient goes into the shock, he falls down, vasovagal shock, simple syncope. Hypericum is wonderful remedy to be given at that time. But one thing you have to do, that if the patient who falls down because of shock, you have to raise his legs up. That is most important logical treatment which you have to maintain. You have to maintain the blood supply to the brain by keeping the head low and the legs are up. This is very important, because otherwise it may lose the little bit blood supply to the brain, can cause damage to the brain in future. And that is the real important treatment whenever the simple syncope is there or vasovagal shock is there. Always modifies and sometimes arrest ulceration and sloughing. So it arrests the specifically the ulcerations. It because of use of hypericum. The sloughing is never happens. Sloughing means damage. The destruction of the tissue is called as sloughing. Calendula is most important remedy locally. Hypericum is internally. Crushed mashed fingertips, and this is very important when persons who used to use work in machine tools, they suffers because of such types of injury. Hypericum, keep it in your mind. First remedy to be think of is hypericum. Tetanus after traumatic injuries. Compare one more remedy, physostigma. So traumatic injuries leading to tetanus, this is the remedy. There are many remedies explained in our Materia Medica. Cuprum is another, Zincum is another, but there the cause is different. Here it is basically the traumatic tetanus is there. This remedy is very important. Then what he says? Vertigo. What type of vertigo? Vertigo with sensation as if head becomes suddenly elongated. That is the sensation as if head has become suddenly elongated. Vertigo specifically at night with urging to urinate. So there is severe urging to urinate and patient wakes up and patient gets a vertigo, specifically at night. This is the hypericum vertigo. Headache, headache after fall upon occiput. Whenever patient falls on occiput and headache develops, hypericum is the remedy. When there is a big head injury and the headache develops, natrum sulph is the remedy. Natrum sulph for the remnant effects of the head injury, either a headache in the form of headache or in the form of psychological mental complaints. The natrum sulph plays very vital role. Headache after fall upon the occiput with sensation as if being lifted up high into the air. So there is sensation that he is lifted up into the air. Headache with great anxiety lest she falls from this height. There is a fear that he will fall or she will fall from the height, and that type of headache. So typical sensations are present along with the headache. It is not simple headache because of injury, associated with those characteristic symptoms which defines very specifically the hypericum. Spine. Yes, very important action on spine. Spine after fall. So spinal complaints after fall. Spine, slightest motion of arms or neck exerts cries. So whenever there is a pain or injury to the nerves, spinal cord, and patient tries to move the neck and patient gets cries with the pain. Or whenever patient raises arm and he cries with the pain over there on the spinal cord, this remedy is very important remedy. Spine is very sensitive to touch. See what he's saying. It is very sensitive. Patient is not allowing you to touch that. Bunions म्हणजे काय? Bunions means painful swelling on the first joint of big toe is bunions. Generally happens to be there with nodosities, with the gouty concretions. Bunions and corns. But here the gout is not so marked. It is a hard tissue which develops over there like a corn. Bunions and corns when pain is excruciating. What he's saying? Pain is of excruciating character, very severe, very as if someone is crushing that, showing the nerve involvement. So it shows the nerve involvement. And last part, convulsions after blow on the head or concussion. So whenever the head injury is there and patient goes into the convulsion, think of hypericum first. Hypericum is a wonderful remedy for that type of convulsions. So here he explains exactly the all varieties of injuries which comes together in the hypericum. So hypericum, one should not forget in such types of cases. Madhu has asked one question, sir, in disc prolapse or gap in vertebrae leading to the compression of nerve, along with the constitutional, can we start hypericum also? Hypericum is for injuries. It is not just because it is a neuritis pain. Whenever it is because of pressure, it is secondary to the osteophytes, which develops over there, or it is because of nerve getting pressed through the specifically through the because of the intervertebral disc. At that time, Vipericum never plays a role. But if it is because of just a pressure over there, it works. For coils, can we use locally in Q? If you have read this from the Murphy's keynotes, he has mentioned, but he has explained that how it works, I don't know. He mentioned he has used just for relieving the pains which are of severe character and it worked. That was his experience, but I have not used for that purpose. Pilas asked, sir, can we think of hypericum in ankylosing spondylitis or history of injury to the coccyx with difficult turning modalities? Not for first condition. Ankylosing spondylitis is a very deep disorder, autoimmune disorder, but very specifically that already I have mentioned coccygodynia. Sciatica, no, it is not. It has been not mentioned directly for the sciatica. How to differentiate between ledum and hypericum? We're going to learn ledum and then we'll definitely differentiate these remedies. I have already told one important thing. Ledum, whenever the punctured wound is there, there is associated with soreness around the parts and or inflammation is there. Here the pain is more important factor. Similar wounds are there, but the pain is very characteristic with the hypericum comparative to the ledum part. After accident, a person will frighten. Can we use rescue remedy with hypericum? Rescue remedy, it's okay. It is a good palliative remedy you can use. If someone takes an IM injection and develops pain, erythema at the site, ledum is very important than hypericum. Involuntary urine stool pass after falling, maybe we can use that is, but that is because many times because of severe pain. Disc bulk compress, do we use? No, it is not indicated for that purpose. At that time, important remedy is to which has capacity to dissolve. Here, the role of constitutional comes along with the calcarea fluor in biochemic forms. Is it useful for tingling numbness of extremities? No. Tingling numbness associated with the sciatica, the remedy which you know, which is the remedy? Tingling sciatica.
Nephalium.
Yes, nephilum. It is nephilum. Very correct. Injury to eye. Yes, it is. It has been mentioned, but not specifically for eye injury. Symphytum is most important remedy whenever there is an eye injury. Symphytum plays very vital role. In some mental injury, can we use hypericum instead of tetanus injection as a preventive to tetanus? First important thing that it is not a proving symptom that tetanus happens to be there. So we should not rely on certain things whenever things are like that. Yes, calendula locally prevents that. Calendula works over there. But don't take a chance over there. My suggestion is that don't take a chance, because it has been in your syllabus that if the tetanus happens, it is rather difficult to cure. And certain things, wherever there are lot of less chances, then you can think about giving the tetanus toxoid to the patient instead of doing that. If there are very crushed injuries, roadside accident with lot of mud entered over there, then don't take a chance. That is my suggestion. That is my most practical suggestion. This is what I used to say. Yes, you give hypericum, no doubt. Alumina silicata, yes, but alumina silicata is not a common remedy. It is very uncommon. So, dear friends, we have discussed this. Let us go with the relationship. Compare the arnica, calendula. Both remedies already we have discussed in length. Ruta and Staphylococcus aureus yet to be discussed, and I will going to learn in recent future about this. Ruta is very good remedy for the cartilageous injuries or cartilage damage. Staphylococcus aureus clean cut wounds, surgical wounds. Staphylococcus aureus plays very vital role. Last sentence what he says: in wounds where formerly aconite and arnica were given alternately, hypericum cures. So if arnica and aconite they were given earlier and still they are not working properly, hypericum, if you give hypericum, it cures that. So that is the thing which he mentioned over there. If you go with the open the Borix Mathematical and the end chapter, that is relationship of remedies, hypericum, there are three antidotes mentioned: arsenic, chamomile, and sulfur. Action is very short again. It is 1 to 7 days only. So we have learned these remedies. We have learned about the calendula. We have learned about the arnica. We are learning about this hypericum. These remedies plays very vital roles in varieties of injuries. Only thing is that we have to catch by watching the injury what type of injury it is. So then it becomes quite easy for us to understand which is the best potency. Always 200 is the best potency to be utilized. Injury in ligaments and tear of ligaments after falling, can we give Ruta? Ruta is good remedy. Definitely Ruta is good remedy. Along with that, yesterday, the remedy which we have discussed is calendula. Calendula in potentized form works beautifully in such types of cases along with the Ruta. Okay. So for injuries 2 months old, can we give hypericum? If it is nerve injury, definitely. Why not? If it is a blunt injury, then arnica. Yes, definitely. So that's all
Sir,
regarding hypericum. Yes, Utpal.
sir, in case of anal soreness, I have got any book from where book I have from which book I got, I cannot remember. But in case of anal soreness in infant, mother tincture can be used. Hypericum mother tincture.
Hypericum mother tincture used by Robin Murphy for the pain in piles. But he said that I don't have I don't know how it works, but it relieves the pains. That's what he has said. I have not utilized for
Okay.
that purpose. So thank you
Okay.
being there, everyone. Thanks, Sanjay sir, who are there, Dr. Varkey sir, Dr. Satyanaran ji, and many more. So thanks everyone for today's session. Tomorrow we'll meet again with the next injury remedy, and we'll continue with this series first, and thereafter we'll turn towards the another. So good night to all of you, and we'll have again a next remedy tomorrow. Thanks.